Zolpidem is prescribed for a brief period to address insomnia in adults. It is effective in helping individuals with difficulty falling asleep to fall asleep more quickly, thereby improving the quality of their rest. Zolpidem is classified as a sedative-hypnotic drug and works by producing a calming effect on the brain. Before you start taking Zolpidem, make sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. Take this medication by mouth on an empty stomach as directed by your doctor, usually once a night. If you are taking the capsule form of this medication, swallow whole. Do not open, chew, or crush the capsules. Do not take a dose of this drug unless you have time for a full night's sleep of at least 7 to 8 hours. The dosage is based on your gender, age, medical condition, other medications you may be taking, and response to treatment. Do not increase your dose, take it more often, or use it for longer than prescribed. If you suddenly stop using this medication, you may have withdrawal symptoms. Tell your doctor or pharmacist right away if you have withdrawal. This medication may sometimes cause addiction, so take it exactly as prescribed to lower the risk of addiction. If you have trouble sleeping the first few nights after you stop taking this medication, contact your doctor. If you feel dizzy, let your doctor or pharmacist know. This medication might make you sleepy during the day, so tell your doctor if you're feeling drowsy. Keep in mind that your doctor has prescribed this medication because they believe the benefits outweigh the risks. Some people may experience a memory loss or changes in mood or behavior, so let your doctor know if you experience any of these symptoms. While it's rare, if you have a serious allergic reaction, seek medical help immediately. And if you notice any other effects, contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. There have been rare cases of people getting out of bed and driving vehicles while not fully awake after taking Ambien. Some people have also been reported to sleepwalk, prepare and eat food, make phone calls, or even have sex while not fully awake. These activities are often not remembered by the person. This can be dangerous and even possibly fatal to the person or others. If you experience any of these activities after taking Ambien, it is important to tell your doctor right away. It is also advised to avoid taking Ambien or similar medications if you have had this reaction to the medication. Before taking Ambien, it's important to talk to your doctor or pharmacist if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. You should also let your doctor or pharmacist know about your medical history, especially if you have kidney or liver disease, mental/mood problems, a history of substance use disorder, sleepwalking, lung/breathing problems, or a certain muscle disease. It's important to note that the effects of Ambien can last even after you wake up the next day. If you didn't get enough sleep or took other medications that made you sleepy, you may feel alert but not think clearly enough to drive. You may also experience dizziness or blurred vision. It's important to avoid alcohol or marijuana, as they can make these effects worse. Children and older adults may be more sensitive to the side effects of Ambien, and it's important to talk to your doctor before using this medication during pregnancy or while breastfeeding. If you notice any unusual symptoms in your baby, it's important to seek medical help right away. It's important to be aware of how Ambien may interact with other drugs. Certain medications can affect how Ambien is removed from your body, which can impact how Ambien works. For example, azole antifungals, rifampin, and St. John's wort are some examples of medications that can affect Ambien. This can increase the risk of serious side effects like slow/shallow breathing and severe drowsiness/dizziness. It's important to tell your doctor about any other medications you may be taking, such as opioid pain or cough relievers, alcohol, marijuana, other sleep or anxiety medications, muscle relaxants, or antihistamines, as they may also cause drowsiness or breathing problems. Also, be sure to check the labels on all your medicines, as some may contain ingredients that cause drowsiness. Always ask your pharmacist about using these products safely. If you suspect someone has taken too much Ambien and they are having trouble breathing or have passed out, call 911 immediately. Otherwise, contact your local poison control center for assistance. Symptoms of an overdose may include slowed breathing or being in a very deep sleep from which they cannot be woken up. It's important not to share Ambien with others, as it's against the law. As you age, your sleep may change and be interrupted. Talk to your doctor or pharmacist about ways to improve your sleep without medication, like avoiding caffeine and alcohol before bed, skipping daytime naps, and maintaining a consistent bedtime. If you forget to take a dose, don't take it unless you can sleep for 7 to 8 hours afterwards. Make sure to store Ambien at room temperature and away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. And remember, don't flush Ambien down the toilet or pour it into a drain unless you're told to do so. When it's expired or you no longer need it, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.